Tonight, frustrations over stay-at-home orders boiling over. New protests from coast to coast. Demonstrators crowded together demanding governors reopen their states as the death toll in America soars to over 40,000. Tonight, the state's already loosening restrictions, where everything from beauty salons to bowling alleys is about to reopen. Also, the new study finding the real number of infections in a major U.S. city is far higher than the official count. Plus, how accurate are those crucial antibody tests? And can they really tell if you're immune? So many small businesses shut out of the relief money and growing desperate. And the backlash, millions in loans going to big businesses. Now a major chain giving the money back. Speaking out for the first time, we're hearing from a worker at a meatpacking plant tied to nearly 900 cases.
A lot of us were getting scared, knowingly that if we didn't show up for work, we might not have a job.
The new images of the conditions inside and the heartwarming homecoming for a 34-year-old father who survived after receiving an experimental treatment. His family says he's a walking miracle.
This is NBC Nightly News with Lester Holt.
Good evening. As most Americans continue to put caution above frustration by staying home and staying apart, protesters in a growing number of states are betting that the risk from coronavirus has been overstated. Groups flaunting social distance guidelines and demanding a restart of the economy. And tonight across the country, a fractured landscape. States still in the throes of mounting death tolls as others see daylight and inch their way towards reopening. Our team is standing by. Let's start with Miguel Almaguer.
Tonight, the fight over how and when to safely reopen the country intensifying 10 days before the national guidelines on staying home are set to expire. With the U.S. death toll soaring above 40,000, states like Massachusetts and Illinois are still considered hotspots. Boston and Chicago seeing a surge of infections. Amid protests today to reopen businesses, New York's governor speaking out.
Nobody disagrees that we want to get out of this situation. Nobody. You don't need protests to convince anyone in this country that we have to get back to work.
By the end of the week, Georgia's governor says fitness centers, beauty salons, and bowling alleys can all reopen. The governor in Tennessee declaring he will not extend the stay-at-home order beyond April 30th. But the crisis is far from over.
They're dying at an alarming rate.
At nursing homes across the country, NBC News confirming more than 9,300 deaths in roughly 4,500 locations. The White House now requiring long-term care facilities to disclose deaths and cases. Meantime, New York, New Jersey, and Connecticut are all moving forward to allow marinas to open with restrictions. North Carolina and Florida have given the go-ahead to reopen some beaches as we approach summer.
This can be the beginning of the pathway back to normal life. But please respect and follow these limitations.
But during spring break, scenes like these outraged many. Now a few beaches are open with limited hours, with bans on sunbathing and gathering in groups. Sam Brock is in South Florida.
In Miami Beach, as the signs would suggest, the beaches are still closed. The mayor here hasn't given a timeline on when that could change, but he is eyeing opening up parks and marinas.
As Texas announces the reopening of state parks, the governor in South Carolina is going further, allowing furniture, jewelry, and clothing stores to get back to business today.
In Los Angeles, where tourism is down 95% and more than half the city is unemployed, the stay-at-home orders go for nearly another month, and they could be extended much longer than that.
Our city is under attack. Our daily life is unrecognizable.
With Las Vegas looking into a possible plan to open the Strip, casinos could use thermal cameras to sense temperatures, reduce the number of slot machines, and offer fewer seats at card tables. But tonight, some worry the gamble to reopen too soon could come at the cost of health and safety. Miguel Almaguer, NBC News, Los Angeles.
This is Stephanie Gosk. In Pennsylvania today, hundreds, sometimes shoulder to shoulder, demanded an end to the state's stay-at-home order.
It's destroying our country, and people like these people are sick and tired of it.
Jesus is my vaccine, spray painted on the side of one truck.
We can't let us go through the summer. It'll hurt too many people economically.
The state has more than 33,000 cases and 1,200 deaths. Public health officials say reopening the economy too soon could put people's lives in danger. Protests like this one have spread across the country, in some cases organized by anti-government groups, anti-vaxxers, and gun rights activists. An NBC News analysis of Facebook revealed that a family-run network of pro-gun groups is behind 5 of the largest pages dedicated to the protests. Some experts believe these groups are taking advantage of people's fears.
They are, organized networks that are trying to kind of foment this anxiety and spread propaganda about the virus.
But there are also those who show up to the protest to express real concerns about the economy and the toll the shutdown is already taking on their families.
I'm not here to discredit the scientists or our doctors or anybody out there. I just want to make America aware that we're not getting the financial help that we're supposed to get.
Over the weekend in Denver, medical workers came out to stage a counter-protest. An NBC News Wall Street Journal poll found that a majority of Americans still say their biggest fear is the economy opening up too soon. 32% worry it won't be open soon enough, a number that has grown in recent weeks.
Open Oklahoma. Let people go back to work. It's time.
And their voices are growing louder. Stephanie Gosk, NBC News.
As that battle plays out, health officials continue to say that widespread testing is the key to reopening America safely. But tonight there's growing concern about the quality of some antibody tests, which detect if you're recovered from the virus and might have immunity. Here's Vicki Wynn.
Tonight, New York health officials are beginning antibody tests on 3,000 New Yorkers to see if they have possible immunity and to detect how far the virus has spread. Meanwhile, there's also a new warning about some of the rapid antibody tests available right now.
My scientific team, they basically said it's a bunch of garbage.
Sean Tabibian's diagnostic lab says it acquired rapid test kits from 5 different manufacturers, but says 70% of the tests gave inconsistent results when his team tried to validate them.
These rapid test kits are dangerous.
Why do you think they're so dangerous?
Well, because they're giving false positives or false negatives. It might give people a false sense of security that they somehow have immunity.
His lab did not look at the test used by Denver's police and fire departments. One finger prick and in minutes, results for these crucial frontline workers.
It's critical that we have this type of information, one, to keep our workforce safe, but also to keep our community safe.
Denver's police chief says they also use a diagnostic test for confirmation and that they've seen a high level of accuracy with the antibody test they're using. But like dozens of other antibody tests now flooding the market, Denver's test has not been approved by the FDA. In March, the agency loosened restrictions, allowing companies to self-validate in an effort to speed up availability. FDA Commissioner Stephen Hahn acknowledging there are questions about accuracy.
I am concerned that some of the antibody tests that are on the market that haven't gone through the FDA scientific review may not be as accurate as we'd like them to be.
To date, the FDA has only approved 4 antibody tests. The ones Tabibian tested were not approved. Neither was the test used in a study by USC and Los Angeles County. Preliminary results suggest the virus is less deadly than first thought and more widespread, with hundreds of thousands potentially infected there compared to 8,000 initially reported cases. And today, Dr. Anthony Fauci responding to concerns states need more antibody and diagnostic tests to reopen.
With what we have, if it is used strategically, we feel we'll be able to have most people enter into phase 1 after they pass that 14-day gating period.
Fauci also says it's reasonable to assume recovered patients have some level of immunity, but right now that's still unproven. It's also unclear how long that immunity might last. Lester?
All right, Vicki Wynn, thanks. Now to the growing financial disaster from this crisis hitting so many people so hard, and with still no agreement tonight on the next government relief package for small businesses. They're left waiting for that desperately needed money. Here's Joe Linkett.
Tonight, small businesses desperate for relief are going to have to keep waiting. Ron Sorek has owned a jewelry store in Pennsylvania for 30 years.
We deferred a lot of our bills and our mortgages and our line of credit.
By the time he applied for the Paycheck Protection Program, the $350 billion fund for businesses with fewer than 500 employees, it had dried up. Lawmakers on Capitol Hill yet to reach a new agreement to add another $310 billion to the depleted loan program, including $60 billion for rural, minority-run, and women-led businesses. This possible second wave of relief comes after several well-known restaurant chains got tens of millions of dollars from the loan program, including Ruth's Chris Steakhouse, Potbelly, and Shake Shack. They used this exception for restaurants, allowing them to apply because they had less than 500 workers per location.
They should have probably had different programs for different sized businesses. The little guy's still flailing in the wind trying to figure it out.
The CEO of Shake Shack, with nearly 8,000 employees in more than 250 locations around the world, now says the burger chain will return its $10 million PPP loan after it found other funding.
There was lots of discussion very early on that the first stage of PPP was not going to be enough. And knowing that, why did Shake Shack continue to apply for a PPP loan?
I think no one knows how long this virus is going to continue. So when given an opportunity, as we understood it, we're absolutely going to work to do anything we can to keep our team members employed.
As a record, 22 million people filed for unemployment in just 1 month, many still struggling to get benefits. In Florida, nearly 650,000 verified claims were filed. Only 40,000 have been paid, just about 6%.
Joe, we also saw today that oil prices turned negative for the first time ever. What does that mean?
Lester, that means there's an oversupply of oil right now as all of us stay home and economies are at a virtual halt. The oversupply and the crash in prices that you saw today is also a sign that it will continue going forward as we keep staying at home. It also means the price you pay at the pump is going to go down. Lester.
All right, Joe, thanks very much. We'll be back in just 60 seconds with our exclusive interview with a worker at a meat processing plant where the virus has exploded and what it's like on the front lines when the pandemic becomes personal. We're back with the concerns about America's food supply and the surge in cases in some big meat processing plants. Our Blaine Alexander spoke exclusively with a worker telling us what they saw inside.
Tonight, some residents of Sioux Falls, South Dakota feel theirs is a city under siege. This Smithfield pork processing plant, one of the area's largest employers, is now a coronavirus hotspot linked to nearly 900 cases. Now we are hearing about conditions inside from a current longtime employee who wished to have their voice disguised.
I started getting really super concerned when a person on my line was diagnosed with COVID-19.
The worker says this is a picture of the cafeteria, outfitted with cardboard dividers and yellow tape for social distancing. But the employee tells us that is nearly impossible.
There's people standing in line outside. There's people inside in the locker rooms, people walking down the hallway. And there's no way of being 6 feet apart.
In a statement to NBC News, Smithfield says it's extremely proactive in responding to COVID-19, supplying masks and face shields for employees and paying workers who stay at home when they're sick. The plant is now closed indefinitely.
A lot of us were getting scared, knowingly that if we didn't show up for work, we might not have a job. A lot of people were worried about their family members and bringing it home and spreading it to them.
Now, this plant accounts for more than half of the state's nearly 1,700 cases, and more than 100 of those are people who came into contact with the employees. A similar situation in Iowa, where authorities say 2/3 of new cases on Sunday were linked to meat plants.
And once the virus is introduced into this type of an environment, it's very difficult to contain.
Back in South Dakota, the CDC tonight has new guidance on when and how to reopen Smithfield safely.
Expanded use of face shields and more personal protective equipment, and then some better communication that can happen within the facility.
And other companies are taking new steps to protect their frontline workers. Starting today, all Walmart and Sam's Club employees are required to wear masks at work, and the company is strongly urging customers to do the same. And in Sioux Falls, like in so many other small communities, meat plants are among the area's largest employer. So once the virus hits that plant, the town feels it very quickly. Lester?
All right, Blaine, thank you. And today, New York's governor proposed hazard pay for workers on the front lines. In spite of signs the virus may have leveled off in some places, this crisis is far from over. Here's Gabe Gutierrez.
Skylar Herbert is now one of the youngest victims of COVID-19.
Both of her parents are first responders in Detroit. Her dad, a firefighter. Her mother, a police officer.
We miss everything, just everything about her.
The 5-year-old, who loves stuffed animals and one day wanted to be a pediatric dentist, spent nearly 2 weeks on a ventilator. She developed a rare form of meningitis, a complication of COVID, before dying on Sunday.
At first, we got the reading that this was strep throat. The COVID virus never entered our minds until she got tested.
Across the country, the toll on frontline workers is unthinkable. Today, New York's governor called for a 50% hazard pay bonus. Dr. Arabia Mollett is frustrated with the protesters who want to reopen the economy.
So it's like a slap in the face, because many of us are out here doing our best to take care of people, take care of our community, take care of our fellow citizens. And it's hurtful, it's painful to see that.
In Boston, a final farewell for Officer Jose Fontanez. Massachusetts just saw its second deadliest day.
There are people in their 20s and 30s and 40s who are coming in critically ill, severely ill, and it's frightening. It's quite sobering. It is certainly not the flu.
Ashley Way is a traveling nurse who's worked in Oklahoma but is now in New York. No training could prepare her for one patient in particular.
She was basically dying. She was very unstable. We were too worried to move her upstairs because, we were afraid that she would die in the hallway.
Harder still was bringing an iPad so the patient could say goodbye to her loved ones over Zoom.
I would say that was probably my toughest day, because I've never had to see anything like that ever. Not having someone at their side while they're sitting there dying.
While they work to care for so many, who will help heal them? Gabe Gutierrez, NBC News, New York.
A look from the front lines tonight. Thank you. Next, our new inside look at the urgent mission to develop a vaccine. In the search for solutions tonight, we're going inside the race for a vaccine. Here's Tom Costello.
At Emory University Hospital in Atlanta, volunteers are receiving the first injections for a potential vaccine against COVID-19, happening in near record time.
Right now, we're trying to make sure that the vaccine is safe. Once we determine it's safe, we also assess if actually the body is able to mount the right immune response.
Vaccines normally take 10 to 15 years to produce, but researchers think they could have a COVID-19 vaccine for widespread rollout in 12 to 18 months. Sonia Bell is married with 3 kids and works in Emory's infectious disease unit. She volunteered to be a test subject for the vaccine.
From NIH to our Emory University faculty, to our staff, to the nurses who drew my blood today. I'm just surrounded by excellence, and I am not worried.
The Emory trial uses the genetic material from the virus to isolate one of its proteins. The body then uses that protein to stimulate an immune response. Worldwide, there are dozens of vaccine candidates, with 2 clinical trials underway in the U.S., including the Emory trial. NBC's Richard Engel has been talking to researchers involved in the second trial.
A doctor working on a vaccine told me what they don't know is this a vaccine that will constantly have to be updated as the virus changes and potentially mutates?
Back at Emory, Dr. Rufael says she feels the urgency to find a vaccine, even from family.
The pressure is on, definitely, from my parents, where they ask me, "So Nadine, did you do it today? Do you have a vaccine for us?" Keep trying.
The Emory volunteers are starting to receive their second round of vaccine injections this week. Because the study seems to be going well, researchers are now opening the study up to elderly participants as well. Lester?
All right. Tom Costello, thanks. And coming up as we continue, an amazing recovery that had the whole neighborhood celebrate. Finally, tonight, a remarkable turnaround for a family we introduced you to earlier this month. Here's Rahema Ellis with an inspiring update.
It's the moment Ilana Goldsmith and her family hoped for, but never thought they'd see. After 32 days, her husband, Michael, leaving Hackensack University Medical Center in New Jersey, arriving home to a surprise hero's welcome.
I was out for so long in what felt like one night, turned out to be 3 weeks.
On a ventilator and in a coma for more than 2 weeks battling coronavirus, he was out of options but for Actemra, an experimental drug, and prayers.
I never really allowed myself to believe that he wouldn't recover. I would actually talk to Michael in my head a little bit and was just like, this isn't your time.
We first met Ilana and her kids about 2 weeks ago.
He used to snuggle with me, and now he can't.
Ilana told me she was living minute by minute.
How are you looking at life now?
That we could live day by day.
Celebrating a new start, and 6-year-old Sophie finally getting what she had been missing.
So last night, my daughter fell asleep in my arms in like 3 minutes.
They're calling him a walking miracle. He is a walking miracle.
Beating the odds, a family reunited, giving all of us hope. Brahima Ellis, NBC News.
So glad we could share that story with you tonight. That's Nightly News. I'm Lester Holt. Please take care of yourself and each other. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.